right, so last session for the year. It's been a wild ride. Thank you for all of those who are here and who have participated and attended all of our past sessions. Some of them, all of them, anything works. We appreciate whoever is keeps attending all of our sessions, and we're super grateful to you all. So today's presentation is titled ABCs of Behavior, and really, if you have been attending our past sessions, for the past 3 sessions, we have really spoken about behavior, and we've dived really deep into the topic. We've spoken about, what is behavior? How do you define behaviors? The different kinds of behaviors, and what is a behavior, and also what is not a behavior. So we've covered so many different things and how we record behavioral data. So today is actually a continuation of that conversation. And today is actually one of the last sessions we will talk about behaviors in depth. And moving forward, the next few sessions, we're kind of gonna switch gears a little bit and speak about some adaptive skills and things like toileting, feeding, sleeping, and things like that. So I'll speak more about what next year holds for y'all and for us in more detail towards the end of the presentation. But today we have Cambria Corsi. So Cambria is a graduate student in the school psychology program at the University of Utah. She is right now doing her board certified behavioral analyst certification. She is mostly interested in improving social skills and peer relations of students with autism spectrum disorder, as well as integrating kind of the school-based mental health services and behavioral techniques to support our students within the school setting. So Cambria has expertise in today's topic, and she uses all of the skills that we're going to talk today on a day-to-day basis when working with her students. For those of you who joined these sessions in the past, you know me. For those of you who are joining today, my name is Chat. I am a postdoctoral fellow in the Department of Ed Psychology at the University of Utah, and my background is also in school psychology, and I've worked with children in the school settings, in clinical settings, and working on assessments, interventions, and promoting mental health services. So that's my background. So for today, like I mentioned before, we are going to talk about the ABCs and functions of behavior. And in the past, if you all do recall, we had Mary and Ashley touch on ABCs. And then last week, we had Lauren touch on functions of behavior. But today, Cambria is going to kind of integrate those and speak a little bit more in depth. She will also focus on creating observable and measurable definitions of behavior, which is, again, something that Lauren touched on briefly, but Cambria is going to kind of go into depth with that. We spoke about reinforcement in the past, but we didn't necessarily speak about what we call differential reinforcement. And I'm not going to tell you more about it because I'm going to let Cambria do that because she's an expert in that as well. And again, how do we use differential reinforcement to increase behaviors increase the behaviors we want to see in children? And something new that we're going to introduce today, which we have not introduced in the past, is using prompts. Again, I'm not going to dive deep into it because Cambria has a great presentation lined up. But here we'll talk about what is a prompt, what are the different types of prompts, and why do we use a prompt, and how do we use a prompt. So real good stuff lined up for the next 60-ish, 50-ish minutes. So with that, I am going to hand over to Cambria.
Perfect. So let me just share my screen really quick with you all, and we'll get started.
Awesome.
Today we're going to be talking about the ABCs of behavior. So Mary and Ashley touched on this a little bit a couple of sessions ago, and we'll go a little more into it. So chat just mentioned also these things that we'll be talking about. So we'll briefly review the functions. We'll talk more about ABCs, talk about the definitions of behavior and how we can make those observable and measurable, what differential reinforcement is and how it's used, as well as what prompting procedures are and how to use those. So first, before we get into anything, we have a poll for you. So we're going to have a little Zoom poll that will pop up on your screen. And it will ask you these different questions.
So the first question is, power is a function of behavior. I know we still haven't talked about this in this session, but think about the past sessions that we all have participated in. We have 70% of the votes in. Let me go ahead. Okay, we have 8. Okay, let me go ahead and end this. Oh, we have 9.
Sneaking
okay.
in.
Yes, I'm actually going to end it. Okay. So,
Okay. Yeah, so it looks like a majority of people are saying power is a function of behavior is true. So we'll talk about this a little bit later and see whether it's true or false. And I'll give you a hint, power is actually not a function of behavior. And we'll talk about what the functions are later.
Awesome. So let's go to poll question number 2. All right, escape is a function of behavior. Okay, we have 90% of the votes in.
Awesome. Okay, and it looks like, again, a lot of you are saying escape is a function of behavior. Yes, so that is correct. Escape is a function of behavior, and we'll talk more about that as well.
Okay, question number 3. Control is a function of behavior. Okay, we have 80% in. And here you go.
Okay, so it looks like this one's a little bit more split than the last two. And these are tricky. So power and control are both things that we might think are functions, but they're both actually not. And so let's go to the next one. And this will be the last one before we get started.
Attention is a function of behavior. Okay, we have 9 votes in. There you go.
All right, 100%. Yes, 100% said true and 100% are correct. Attention is definitely a function of behavior.
Awesome.
All right. Perfect. So we'll talk about, we just talked about attention and escape, and there's another one that we'll talk about, but just to briefly review the functions of behavior, keep in mind that when we're talking about these, behavior is communication. So behavior is how we're telling people what we want. And so when a student or a child is behaving a certain way, they're trying to tell you something that they want or need. So the functions of behavior. We talked about access. Attention is part of access. So a child might be behaving in a certain way because they want to get something. They might want to get something like tangible, like a toy or a food item. They might want attention from another person, maybe a teacher, a family member, or a friend. Another function of behavior is escape. So this is to get away from something. And so this might be a child wants to escape demands that are being placed on them, such as assignments or situations that they don't want to participate in. or that they feel uncomfortable in. So maybe if they're speaking with someone who's unfamiliar, that's uncomfortable, they want to escape that situation. Maybe if they're receiving attention from someone they don't like, they want to get away from that. Or if they're being asked to go somewhere or do something that they just don't want to do, they would want to escape that. And then another function of behavior is automatic reinforcement or sensory. And so this is to feel pleasure or body awareness. And so like using like fidget toys can get at this function. There are different types of body behaviors that can get at that function. So remember that things like power, revenge, control are not necessarily functions of behavior. They might influence behavior, but they're not necessarily functions. And also an individual doing something because they might have a specific diagnosis is also not really a function of their behavior. It might influence it, but it's not a function. So what are the ABCs of behavior? So A is for antecedent. So this is what happens before the behavior or what the trigger is, what sets off the behavior. Behavior is what did you see? So that's the B. And then the C is consequence. So what happens after the behavior occurred? And the consequence is what maintains this behavior or what keeps the behavior occurring in the future. So for example, if a teacher asks a student to complete an assignment and the student says no, and then the teacher removes the assignment, says, okay, that's fine, you don't have to do it right now, the student is learning the function of that behavior is escape. And so the student will continue to say no in the future when assignments are presented because they want to escape that task. And so in that example, the teacher asking the student to do the assignment is the antecedent, the student saying no is the behavior, and then the teacher removing the assignment would be the consequence. So why is this important? Why do we even care about the ABCs of behavior? So the ABCs help us understand why behavior occurs. They help us understand what the function is. So is the function attention, escape, access to a tangible, automatic, or sensory? And understanding the function can help us to understand how to best support that child and ways that we can provide them with what they need and teach them to ask for those things appropriately. So another example, just an example sentence for you. So when an antecedent happens, the student or child does a behavior in order to obtain a function. So for example, when Amira is asked to do her homework, she crawls under her desk in order to avoid or escape the task. So what can we do to record this ABC data so that we can have data points that we can base our interventions on and then assess whether they're working? So first, you want to record the start time and the end time. So does this behavior happen during a specific time of day? Maybe it happens right before lunch. If a student is feeling hungry, they might be more likely to engage in a problematic behavior or a behavior that you don't really want to see. So you want to note the time of day and how long it lasts. Also note the context or the setting where this behavior is occurring. So maybe the problem behavior happens during a specific activity or with a specific person. Maybe a student really doesn't like math, and so they have a lot more problem behaviors during math, or maybe they don't like one of their teachers and they don't do assignments in that class. So it can be different people, different settings that can set off these behaviors. Or maybe they don't like reading and so they don't read during class. And so I've talked a little bit about things that can set off behaviors. And so on that note, we're going to talk about setting events. So these are environmental events that indirectly affect behavior, and they temporarily change the value of reinforcement or punishment. So some examples would be getting in a fight before school. If a student comes to school after a fight, they might be in a bad mood. They might be feeling just different than usual and might be more likely to not do what they're supposed to in class. Maybe if they forgot to take medication, that would affect how they're behaving, or losing a family member. Those personal things that can affect how they're feeling, which can then affect how they're doing in school. And so setting events are things that set up problem behavior, and then antecedents in our ABCs are things that set off the problem behavior. So back to recording ABC data. So the purpose of recording this data is to identify the antecedent, behavior, and consequence. And from that, we can identify the potential function of the behavior or why it's occurring. So for example, if a student or if a teacher is reading a book to the class and then a student interrupts the teacher and tells a joke, classmates then laugh and the teacher asks the student to be quiet. What do you all think that the function of this behavior would be?
And
And
feel
if
free
you,
to, yeah, sorry. Feel free to use the chat function if you want to.
yeah. So would it be escape, attention, or access to tangible, or would it be automatic or sensory? Yeah, I'm seeing someone saying escape or even attention seeking. Yeah, so when I am seeing this example, I'm thinking attention because the student is receiving attention from classmates with their laughter, and also attention with the teacher asking them to be quiet. But the function could also be escape because they might be wanting to escape from reading the book, so they're talking about something else, telling a joke. Yeah, so it can be definitely complicated to try to figure out the function sometimes, which is why we want a lot of data points to be able to do so. So this is just an example of what a data sheet might look like when you're taking ABC data. And we're going to watch a couple of videos and then we'll fill one of these out together, or a couple of them out together. So this is one example video. And let me know if you can hear sound or if you can't hear sound.
Cambria, you might have to share your computer sound.
Okay. 1 second. Let me try and figure out where that's at.
That so it's actually on the Zoom. You know, when you share your screen.
I think I found it.
Okay, perfect.
Let's start this over and
Maybe like maximize the volume on this video.
Okay, it's time to finish.
No.
All right, looks like you're not done. Let's do 5 more minutes, then it's finished.
okay. So now we're going to talk about that video and about what was going on in that video. So, oh my goodness, sorry. So for the data sheet, are you guys still seeing the presentation?
Yes.
Okay, sorry, my screen went to something else. So for this data sheet, we're gonna fill this out together. So let's just say that the date is today, the time is 11. Looks like the setting might be in like an office. And then what did you notice as the antecedent? And feel free to put your responses in the chat. So what happened before the student did a behavior or the child? Yeah. So the adult, whether it was the mom or the teacher, whoever it was, asked the child to stop, said it was time to finish. Right. And then what was the behavior that you noticed from the child? Yeah, right. So the child said no. And then what happened after the child said no? So what was the consequence? Yes, exactly. So mom, teacher, whoever it was said, okay, you can have 5 more minutes. So in this situation, what do you think the potential function would be? Why is the child continuing to say no? What is the child getting from it? And remember, those functions of behavior are attention, access to tangible, escape, or automatic, or sensory. Yeah, I'm seeing access in the chat, definitely. And access, do you think it's access to attention or access to tangible? Right, yeah. So the child wanted to access the tangible or the computer. Yeah, you guys are on it. Okay. So now we're going to watch another video, and then we'll do the same thing after this one.
All right, Duncan, we're going to work on your letters now.
No.
It looks like you might need a break. Here you go. Here's your pinwheel.
Okay. So we'll X it out so I can type. Okay. So again, we'll say the date is today, time 11. Looks like they're in a classroom maybe. And then what was the antecedent, or what did you see right before Duncan's behavior? Yeah, so it seems like they were doing an activity he didn't like, and the antecedent was the teacher saying it's time to work on letters, and setting the cards down for him, right? So it's time to work on letters. And then what was his behavior? What did he do after that was said and after he was given that instruction? Said no and pushed the letters away, right? And then what was the consequence? So what happened after he pushed the letters off and said no? Yeah, the teacher gave him a pinwheel. So what do you think the potential function or multiple functions might be with this kid? Could be tangible, maybe wants access to the pinwheel. Could be sensory. There might be some body awareness or pleasure that he gets from feeling that pinwheel, totally. And yeah, definitely there can be more than one function. So if you think there's multiple functions, Yeah, I'm seeing access to tangible, also possibly escape from learning. So he escaped the task. So it could be any one of these things, or multiple of those things. Right. Awesome. Okay. So just a review after talking about all of those things, why again is it helpful to know the ABCs of behavior? So the ABCs help us determine the function. Why is the child doing this? Why is Duncan pushing the cards off the table? Why is the girl in the first video saying no? And then what can we do about it? So when we know the function, we can change the antecedents and the consequences. So we can change what we do before and we can change what we do after to increase the behaviors we want to see and decrease the behaviors that we don't want to see. Some more review just about what behavior is. I think Mary and Ashley touched on this briefly, but we'll talk about it again because we're going to go into defining behavior. So before we do that, we'll talk about what it is. So behavior is something an individual does in response to a stimulus. So as we've seen in these examples, behavior is saying no, maybe when given an instruction. An example of behavior would be sleeping. There are also things that are not behaviors. So feeling tired would not be a behavior. So behaviors need to be observable. You need to be able to see them, and they also need to be measurable. So that means that you can describe how frequently they're occurring, how long they're lasting. And then there's also something called the dead man's test. So if a dead man can do it, it's not a behavior. So now we have another poll, just 2 questions really quick for you, just to talk about and introduce this idea of defining behaviors in ways that are observable and measurable. So for the first question, it's just a yes or no, what you think. I could easily define aggression in a way that's observable and measurable.
Okay, we have 63% of the votes in. I'll give it another second. Okay.
Perfect. Okay, so we're feeling a lot of you are feeling that you could easily define aggression in a way that's observable and measurable, but some feeling that might not be as easy. And we'll talk more about that in a couple of slides on how to define those things. So for the next question, I could easily define non-compliance in a way that is observable and measurable.
Okay. 90% of the votes in.
All right, and for this one, it looks like a lot of you are feeling the opposite. So most people feeling no, that would be harder to define, and then some people feeling like it would be easy. Yeah, so behaviors can be easy sometimes and can also be complicated to try to define. So we'll talk more about that. So why, first of all, is it even important to define behavior? So when we define behavior, we can measure it objectively. And then we can quantify it, so we can put a number on it. How many times is this occurring? How long is it occurring? And then we can look at it before and after an intervention to see if interventions are effective in increasing behaviors we want and decreasing those that we don't want. So now let's just practice defining and creating operational definitions of behavior. So if you just want to share in the chat, and we'll start with the first question on the left, how would you describe the behavior of aggression? So remember, you want it to be something you can observe, something that you can see, and something you can measure. So thinking about how often it occurs, and how long it lasts. What are some things that you would say to describe the behavior of aggression?
And again, feel free to type up here. Or if it's something long, feel free to unmute your mic and speak.
Yeah. Always welcome to verbally share if you'd like. Yeah, okay. So some specific behaviors: hitting, kicking, biting, shouting, and then also they are behaviors that are aimed or directed at somebody or something. Yeah, other definitions or other ways you would define or describe aggression. And I think when we think about this, let's think of physical aggression. So there are different types of aggression. Maybe there's verbal aggression, or there can be passive aggressive behaviors. And so I'm noting like not talking, ignoring others, isolating oneself. Those might be more like passive aggressive. Um, let's think more like physical aggression, just to make this definition as easy as possible. So for you're getting the hitting, kicking, biting, shouting, it also needs to be aimed at someone or something. And then we want to describe how frequently is it occurring? Is it happening, 10 times a day, 5 times a day? What is the frequency? And then how long does it last? So if a child is hitting someone else, do they hit them one time? Are they hitting someone else for 2 minutes straight? So we want to measure the duration as well as how often it's occurring. And then for noncompliance, how would you describe that behavior? I think not talking, ignoring others, isolating yourself could all be examples of noncompliance. So if you're given an instruction and you ignore that instruction, that could be noncompliance, right? So not listening to given instructions. If you are isolating or trying to escape a task instead of doing it, that could be noncompliance. Saying no, as we saw from the girl in the video, or from the boy when he threw the cards off the table. These are all different ways that we could define noncompliance. And then we want to talk about how many times does that happen? How often does a child ignore somebody or isolate themselves? And then when they do that, how long is that happening for? And remember, so with non-compliance, this is a tricky one because we have to remember that behavior is something that we can see, something that someone is doing. And so when we're defining behavior, we want to talk about what the child is doing and not really what the child is not doing. So when we're making a definition for non-compliance, instead of saying not talking or not listening, we might say something like looking away, to really show what the child is doing instead of what they're not doing. Okay. And now we're going to get into differential reinforcement. So this is something that we can use to increase the behaviors we want to see and decrease those that we don't want to see. And what differential reinforcement is providing reinforcement for one type of behavior while withholding reinforcement for another type. So the student must show a behavior other than the problem behavior in order to receive reinforcement. And differential reinforcement reinforces a reduced rate of problem behavior. And there are 4 different types that we'll go over pretty briefly. So the first type is differential reinforcement of an incompatible. So this is when you reinforce a behavior that physically cannot occur at the same time as the problem behavior. And while you're doing this, you're also withholding reinforcement for the problem behavior. So planned ignoring is one example of this type of reinforcement. So if you ignore the behaviors that you don't want to see, you only reinforce the ones you do want to see. So maybe if you don't want to see your child asking a lot of questions, too many questions, you would reinforce when they're not asking too many questions, and then you'd ignore maybe if they are. And so another example of this is, and that would be planned ignoring. So for example of an incompatible behavior with a fidget toy, a child could use this instead of like a behavior like hair pulling. So that keeps their hands busy, so they actually cannot pull their hair while they're doing that. And then for differential reinforcement of alternative, this is reinforcing a desirable alternative or replacement behavior. So this doesn't necessarily need to be an incompatible behavior. It just needs to be an appropriate replacement behavior. Again, you're withholding reinforcement for the problem behavior. So an example of this is break cards for a child who might be doing a behavior to escape something. So you can give them a break card, they can ask for a break, and that is an appropriate way for them to escape instead of maybe leaving the room without letting you know. And remember, when you're choosing the behaviors to focus on for incompatible or alternative differential reinforcement, you want to make sure it's a behavior the child can already do that is less effortful than the problem behavior. So it requires less effort. And you want to make sure that it has the same function as the problem behavior. And then differential reinforcement of other is reinforcing the absence of problem behavior. So any other behavior. And you can add this type of differential reinforcement when interventions maybe aren't being as effective as you'd like them to be, to help increase the behaviors that you'd like to see during those interventions. So for example, if you're seeing a student has a problem behavior that maybe they're disrupting class, they're talking, they're not doing their work, they're walking around. When you see them sitting at their desk in their chair and they're doing their work, anytime you see that, you can reinforce that. And then our last type of differential reinforcement is low. So this is when the behavior itself is not necessarily the problem, but the frequency or how often the behavior is occurring is what is the problem. So this is helpful for decreasing excessive behavior. And you don't want to use this for dangerous behaviors. So if a student is doing a behavior more than you want them to, maybe they're talking to friends a lot, and that's not a problem in and of itself, but if it's interfering with schoolwork in the classroom, right, then you want to reinforce maybe a lower rate of that behavior. And another thing that we are going to talk about that you can do to increase the behaviors you want to see and decrease those you don't want to see is prompting. And so prompting is a technique that helps individuals learn new skills. And there are 2 different ways to go about it. So you can do most to least intrusive, or what's most invasive to a student, and then move to what's least invasive. Or you can do least intrusive to most intrusive as your sequence. And there are 5 different types of prompting, and we're going to briefly touch on the first 3. So we'll talk about physical prompting, model prompting, and verbal prompting. So an example of a physical prompt, this is when a caregiver or a teacher, an adult is physically helping a child to accurately perform a behavior. So maybe hand over hand, if a student is trying to write their name, but they're not able to, you would use this type of prompt to put your hand over theirs and help them write their name. So that would be a physical prompt. And then a model prompt would be a caregiver or teacher showing the desired behavior while the child watches or while the child observes. So if you're wanting a child to raise their hand, you can raise your hand and model that behavior to increase the likelihood that a child will also model or will follow that model and do that behavior after you. And then the least invasive type. So remember, physical is the most invasive. And then this would be less invasive, so verbal. So that would be providing a verbal hint. So for example, in the morning you brush your, and then you would expect the child to say something like hair or teeth. So you're giving them a hint verbally of what they're supposed to say, how they're supposed to finish the sentence. Another example is apple starts with the letter, and then you'd expect them to say A. So helping them along. And then how do you use prompting procedures? So when you have a child who doesn't actually have the skills and is not able to do a behavior on their own, you would do most to least. So you'd start with the most intensive or that physical prompt, and then you would fade to the least intensive prompt as the child is learning this skill. So for example, if a child is learning to write their name with the most to least sequence, you might start with a physical prompt by guiding their hands while they write. Then you might guide their elbow later as they're learning to write, and then later might give them verbal hints to form the letters correctly. And then with this least to most sequence, you would use this if the child has the skills to perform a behavior, but is not doing that behavior on their own. So you'd start with the least intensive prompt, and then if needed, you would go to a more intensive prompt. So with this same example, the child's learning to write their name. They know how to write their letters. Maybe they know how to spell their name out loud. And now you want them to actually write their name. So you'd start with a verbal prompt. You'd ask them to write their name. If they don't do that, or if they do it incorrectly, you would say something like write letters. Maybe their name is Keith. So you would say K-E-I-T and H. And then if they still don't do it, you would model, you would write their name. And then if they still are not able to write their name, you'd move to a physical prompt and you would guide their hands to help them do that. And just some tips for using prompting procedures. First tip is ask. So before using any prompts, ask the child to perform the behavior on their own. This will give you an idea of where they're at and if they're able to do it or not. And then you can determine which sequence of prompting you need to use. The next tip is always keep the original instruction the same at each level. So if you're saying write your name, you want that to be the same at the verbal prompt, at the model, at the physical, and so forth. And then alter the levels of prompting to fit the needs of each child. So as we talked about, if they actually cannot do it, if they can't do the behavior, you'd start with most to least. But if they might be able to do it, you could start with least to most, and then help as needed. So that was a really brief snapshot of prompting. And that is also the end of our presentation today. So if you have any questions, feel free to reach out. Those are our emails. You can shoot us an email. You can write those down if you want to email us later, or if you have questions now, feel free to drop them in the chat or ask out loud, whatever you're comfortable with.
Thanks so much, Cambria. I think this is like perfect timing. We have a good 10 minutes to take any questions that folks may have. And, some of this information probably is redundant, but I think it's a good thing because that helps us, refresh every single week. But also we were able to cover some new information that's particularly helpful when it comes to, some sometimes, you try to reinforce kids and sometimes it just doesn't work. So, in situations like that, it's always helpful to, see and talk about the different types of, like the differential reinforcements, essentially. So keep those questions coming on the chat if you all do have any, but I am going to.
And it looks like we have a raised hand if you want to go ahead and ask your question.
Oh, good catch. I did not see that.
Hi. So I would like to know more details about why you say that power and control are not necessarily functions of behavior. Because I always thought that, okay, if the child feels like they are not in control of their environment, then sometimes they tend to have like a massive tantrum, right? So I'm a bit confused about that.
Yeah, totally. I think that that is confusing for a lot of us, right? So it does seem like power and control are things that do influence behavior. And so I think that's the difference is, does it influence behavior or is it a function of behavior? Is it what the child is trying to get? And so while they might want control, they also might be more so wanting that access to a tangible or access to attention. Maybe they want to escape or get that sensory function. So for example, if you are taking away a tangible and a child is having a tantrum when you take that away, we can look at that as them trying to control whether they get that tangible,
Yeah.
but the
Yeah.
real function is wanting the tangible. So it may seem like control is the function.
Okay.
Does that make some more sense?
Yeah, I think it does. Thank you.
Yeah, thanks for your question.
Yeah, that's a good question, Anishka, and thanks, Cambria, for responding to that. And I think Cambria was spot on. So control is, again, you see children trying to be really stubborn and just sticking to what they believe and, not willing to give in. That, again, is their way of either escaping from something, trying to get attention, or trying to, again, access an item or an activity, so like a tangible, again, sensory. So it's just the child's way of, using control. And what's the other thing that you mentioned, Anishka?
I think was it
Power.
Sorry?
Power.
Power. Yeah. So it's almost like I am going to be stubborn and I'm going to stick with what I say you as an adult should do because I want to access something that I want. And
Okay.
yeah, so essentially it's like it still boils down. So power and control, it really boils down into those four functions. And that's also like what the theory says and what the research says about those core functions.
Okay. Okay. Thank you.
Yeah, good question.
Yeah, an example of an appropriate way to change the consequence in order to change the behavior of children that we want to see more, that we do want to see more. Okay. Yeah, so I think, so with reinforcement would be the consequence that you would give for a behavior that you'd want to see more of. So, for example, if you have a child who is typically not doing an assignment, maybe not doing their homework, and you give them the instruction to do it, they usually don't, but then one time they do, right? You want to provide as much reinforcement as possible for that. So great job doing your homework. I'm so proud of you. Thank you for finishing your assignment. And so that great job doing your homework, I'm so like those statements that you're saying to the child would be that consequence. And you would give them attention for that and reinforcement. And then that would increase the likelihood that they would do that in the future.
And Natasha, let us know if you have like any follow-up questions to that response. But we did have another question, and Cambria, thanks for addressing that.
Mm-hmm.
Another question, Kitmini, you had mentioned, so your question is, what can we do if a child is trying to escape a situation because she's scared or doesn't like a particular person? This question is actually really interesting. And first, you know, it's important to know why this child is scared or doesn't like a particular person. And my mind goes to concerns of safety. Like, is this child trying to tell us something about an experience with a particular individual? So I'm not too sure how old this child is, but I think it'll be important to ask some of those reasons as to why. And honestly, you know, thinking of adults, if we're scared or we don't like people, we will probably mostly avoid or try to escape that situation, right? And you know, kids are no different. So, like I said, going back, it's probably going to be helpful to identify why this is the situation or why this is the case, and also see if there are concerns for safety. And I would go from there. Yeah.
Any other questions that you guys have? I think we just have a little bit of time left.
Yeah. So let me, yeah, go ahead. Sorry. Oh, thank you.
I was just stopping sharing. Hopefully everyone was able to get our emails. If not, just shoot one of us a chat and we can provide it.
Absolutely. So super quickly, so that was a Q&A. So beginning next year, like I said, the series is gonna switch gears in terms of content areas. So next week we have Laura Pips. Laura is actually a board certified behavioral analyst at the Munramai Institute, University of Nebraska Medical Center. And she works in the feeding department at the Institute over there, MMI. So she's going to join us, which is our first session next week on the 2nd of January at 10 in the morning, to really talk about, you know, feeding difficulties, feeding concerns in children. Like, what are feeding difficulties? Could be picky eating, could be food selectivity, could be like physiological things or biological things like difficulty swallowing, choking, and things like that. So she'll touch briefly on, you know, the different feeding concerns. She will also touch on, how do you know if your child has a feeding problem? Is this child, again, being stubborn or just not wanting to eat? Or does this child really have a concern concern when it comes to eating? So can your child eat, or does your child not want to eat? So, you know, there are differences, and being able to identify those is going to be really important, because if that is the case, your child may need to seek medical attention as well. So really being able to know what these concerns are, identify what the warning signs are, and you know, referring your child to medical providers in a timely manner, because those are really important things as well. And she'll also talk about, you know, when you do go to a medical professional, what are some things that you can collect data on, because you know, when you go to a medical professional, it's always helpful to have kind of that feedback that you can supply to the medical professional in order to effectively diagnose and create like treatment schedules. So she will talk more about that. And let me super quickly, if you all are interested, go ahead and register. We are hoping to actually cap the number of participants on this session, because we are expecting a ton. So just to make sure that we are able to answer everyone's questions. and share that information. Okay. So if you all do want to go ahead and register, if you have not, that is the link. And with that, we come to the end of our session.